Hello everybody. Since my last video that I posted about having children, I've received some questions about taking medications while being pregnant and the side effects and if that's a good thing to do or a bad thing to do. And I've done some research on the internet, and I'm going to post the links to the websites that I'm taking this information from. And basically I just kind of highlighted some key points, but there's a lot of information, and I would suggest that you read the articles and do research of your own. Some of them have links, well, not links, but I forgot the name already. Hold on a sec. References, sorry. They have references. So if you want to, dive in further and really get a handle on these questions, because I can only answer it from a layman's point of view. I'm not a doctor, I'm not a psychiatrist. I can only tell you what I've been told and what I've read. So I'm just going to go ahead and give you some of the key points. And first of all, when it comes to taking medications during pregnancy, it's very individualized. Not everyone is the same, because not everyone has different a chemical makeup. So one person is taking one medication, one person's taking another. So it really depends on what you're taking and your level of functioning. And basically, a big factor in determining what could be done with pregnancy and medications is what was your level of functioning before you were on meds or during a period when you weren't on meds. Some people might not be able to function properly, for instance, not, getting prenatal care. So that is a factor in determining, what types of meds you might be on, or whether you should not be on medication during pregnancy. I have some notes here, so if I'm looking down, that's why. Some meds have few or no side effects during pregnancy and are safe to take. Others are associated with congenital birth defects, behavioral disorders, and perinatal disorders. Lithium is a known tetragen, which basically that means it can cause birth defects. In the first trimester, there's an increased risk for Epstein's anomaly, which is basically a heart defect, and it increases by 10 times. The risk is 10 times greater than somebody who is not taking lithium. And this is also associated with perinatal syndrome. Valproic acid, can increase the risk of fetal malformation up to 4%. High-potency antipsychotics like Haldol are associated with no increased risk to the fetus or baby and are recommended for high-risk pregnancies. Low-potency antipsychotics are not recommended and may increase the risk of fetal malformation. Atypical antipsychotics, basically that's like Prozac and the new medications that they have. There's not enough data on them, so they don't really know what the side effects could be to a fetus or a baby. And if you're on something like that, then I guess the high potency antipsychotics are recommended during pregnancy or the first trimester, or whatever the situation is, because everybody's different. And a few months ago, I thought I might have been pregnant, And when I went in to see my psychiatrist, he told me that because I'm on Seroquel and lithium and Celexa and gabapentin, he told me that my meds would have to be changed. Not that I would necessarily have to go off of them, but that they would have to be changed because of the risks that lithium and Seroquel carry. Now, I'm not saying you should not be on medications during pregnancy. Basically, I think you really have to talk with your psychiatrist and your obstetrician and do research and really be informed about the side effects of medications. And it really comes down to the risk factor. Is it more risky for you to not be on medications, or is it more risky for you to be on medications? Because if you are somebody who goes off your medications and then things happen and you don't take care of yourself, not getting prenatal care and all that stuff, that can pose a risk to your baby by not being on medications. Whereas somebody might need to go on a different medication on a lower dose and still stay, relatively stable, and the risks of those medications, of being on them, outweigh the risk of not being on the medications. So I really urge you to talk to your doctor and do the research, ask them if they have any literature or anything like that. Try to find other women who have been pregnant or are pregnant who are on medications or who are not on medications. Get their feedback, because the only person who really knows is the person who's actually going through it. So I would suggest you do that. Now, I guess, for me, I was undiagnosed at the time. I was not on any medications. And maybe I should have been, because I was, I was not myself. I was very unhappy when I was pregnant. I cried a lot. I had fluctuating mood swings, but that also comes with pregnancy. So it's hard I guess it would be hard to tell if it was from bipolar or just from being pregnant, or a combination. And after I had my child, I was never diagnosed with postpartum depression, but I think, given how I felt and, after I had my child, I was 19 when I got pregnant. I had him when I was 20. I was younger. I was a teenager when I got pregnant, and I was about 9 months out of high school when I found out I was pregnant. So I guess in some ways I felt that I lost that, that time in your 20s when you're figuring out who you are and you have no responsibilities, really. And then suddenly I had this baby that I had to take care of. And it was scary. And I didn't know what to do. And a lot of times I would look at him and I would be angry with him because I felt like he had taken away a part of my life, in a sense. But as time went on, I realized that I didn't lose anything. I actually gained everything. I gained somebody who makes me happy, and somebody I can be proud of, and you know, it's been a long journey for me and him. You know, we've both gone through a lot in the past 6 years, and, you know, I don't know, my moods right after I had him were very, they weren't right. You know, they say that right after you have a baby, you have this euphoric feeling and you feel instant love and all that stuff, and I didn't feel any of that. And it made me feel bad because I thought, well, what's wrong with me? Why don't I feel this? And it took me and my son a few years actually to bond. The instant bonding did not happen. And I think a part of that was my moods, you know. But anyway, kind of going off on a tangent there. You know, talk with your doctor. Make sure that you discuss all the possible side effects, benefits, you know, everything. And on here they have things to consider. If you are pregnant and taking a psychiatric medication, you should speak with your healthcare provider. Find out about the risks and benefits of continuing with the medication during pregnancy. In some instances, the risk to your baby may be too great to warrant the continuation of the medication. However, if the medication is necessary to your well-being, it may actually be better for your baby if you continue to take the medication. Medication often prevents behavior that may put your baby at risk, including alcohol and drug abuse, exposure to sexually transmitted diseases, and lack of prenatal care. So, if you guys have any more questions, please feel free to ask them. I will answer them in any way that I can. Again, these are just, usually I just read this stuff off the internet when it comes to this kind of stuff, and, you know, whatever I can give that I've personally been through, I'll try to discuss that, like I just did. So yeah, I hope that I answered some of your questions, and again, I'm going to post these links so you guys can read them on your own and, you know, come up with your own conclusions. So, yeah, I hope that this was helpful for you.